Prostate biopsy is the way prostate cancer is diagnosed. And it's come a long way in the past 20 or 30 years. When I first started out, we used to put people in the hospital, put them to sleep, and use almost like harpoons to biopsy their prostate. And then what happened in the last 20 years is something called a bioptic gun was developed. And actually has kind of revolutionized the diagnosis of prostate cancer, but it's also created a lot of the controversy where it's so easy to biopsy somebody, and we know that if you live long enough, you're at risk of getting prostate cancer. And so we find a lot of ones that we don't want to find in that. So my talk focused on how to go forward with prostate biopsies, and basically what we looked at was a couple things: defining people for active surveillance, number one, and number two, also maybe modifying biopsy techniques. And so if you look at almost every cancer that we diagnose, we basically do PET scans, CT scans, things like that. In prostate cancer, those things are a waste for localized disease because we're not worried about them spreading, we're not worried about lymph nodes. We want to know what's going on in the prostate, we want to know the grade of the cancer and how much, because that's what determines how we treat patients. And so patients sort of, literally life and death decisions are made on random transrectal biopsies. And so our way forward was in low-risk patients to define them better by doing something called mapping biopsies, which are done under the scrotum. They're done 5-millimeter intervals. We may do 70 to 100 biopsies. We label those, we put them in a computer program, we 3D reconstruct the prostate. We know where the cancer is. We can watch it. We might be able to treat it with a laser ablation or with freezing, or another thing is maybe they should get definitive therapy. So I think the way forward is we need more information, and knowledge is power, and that's why we like doing these mapping biopsies. Not in everybody, but in a lot of patients.